So good morning, everyone. Welcome to today's COHTAC Share and Learn, Bridging Head Start and Local Oral Health Programs Together, partnering to meet Head Start and state requirements. I'm Janelle Urata, and I'm with the COHTAC team. Thank you all for joining us. COHTAC is funded by the California Department of Public Health's Office of Oral Health, and we're grateful to have their continued support. You'll see in our acknowledgments and disclaimers on the screen. Just a little bit of housekeeping. Before we begin, today's webinar is being recorded. The recording, slides, and resources will all be shared in a follow-up email after the session. We welcome questions and discussion in the chat, so please keep your microphones muted during the presentations, but feel free to enter in your questions into the chat. And if you could kindly add an @ in the person or the group that you're addressing your question to, that will help us organize our questions a little bit more efficiently. We're hoping that we can answer some of the questions in the chat, but if not, we'll address them at the end of the webinar or in the emails at the end. We'll also be sharing a short evaluation survey at the end of today's session. We just wanted to emphasize how important your feedback is. It helps us show the impact of this work and ensures that we can continue offering these share and learn opportunities in the future. So we read every response, and we're very grateful when you take a few minutes to complete it. If you're experiencing any technical issues, Khadija and I are available to help. So we're going to take a quick look at today's objectives and agenda. We'll start with a high-level overview of California oral health and local oral health programs presented by Dr. Kristen Hoft. Then we'll hear an overview of Head Start programs from Ristin Ruley and Chris Cochran. And then Dr. Hoft and Dr. Vaishali Sundarajan will walk us through the Kindergarten Oral Health Assessment, or KOHA. Then we'll spend the bulk of our time learning from local partnerships, examples in Madera, Santa Clara, Solano, and Tehama counties, hearing directly from local oral health and Head Start partners in each region. We'll wrap up with resources, next steps, and then a Q&A. And Khadija will also share a link in the chat where you can read more about the speaker bios. With that, I'll turn it over to Kristen to get us started.
Thank you. So I'm going to start with an overview of oral health in California and a little bit about what is an LOHP. We have some participants here today from Head Start who may not know what an LOHP is, and so I'm going to give you just some background introduction. Next slide. All right, so did you guys know that oral health is critical to overall health? And tooth decay is the most common chronic childhood disease in the United States. It's 4 times more common than asthma, 20 times more common than diabetes, and 3 times more common than obesity. So it is affecting a lot of our children. Next slide. So in California, over half of children have tooth decay by kindergarten, so by around age 5, and 19% of those have extensive decay. So that's having it affected them more strongly in their mouth. And over 350,000 California school children were absent for at least 1 school day for a dental problem. And a lot of those were absent for more than 1 day. So it's something that is affecting their oral health, which affects their general health, and also their schooling. It's making them not able to attend school and not able to be their best selves at school. And we know how important education is. Next slide. So that was the kindergarten information, and now we have caries. So among 3rd graders, so cavities among 3rd graders, and this is divided by socioeconomic disadvantage. So the turquoise-ish blue color is not economically disadvantaged, and you see their percent is lower at 41% of having cavities at all. And then the pink column is socioeconomically disadvantaged, and that's much higher at 73%. So we see not only do a lot of people have cavities, but it's not evenly distributed throughout the population. Lower income children have much higher or much more low income children have cavities compared to higher income children. And when it comes to untreated decay, so this is tooth decay that's continuing to get worse in their mouth, that same disparity exists where children that are of higher income in this turquoisey blue, much fewer of them suffer from untreated tooth decay compared to a quarter of children that are socioeconomically disadvantaged. And so this is telling us that early intervention is essential and that all children need access to dental care and attention around oral health so that we can give everybody access to healthy mouth. Next slide. I want to give you a little background about some of the things that have happened in California over the years around oral health. So we got our first Office of Oral Health and Dental Director here in 2015. Before that, oral health was kind of under the umbrella of the Department of Public Health, and it didn't get as much attention. And so starting in 2015, we got to have a dental director that was thinking specifically about oral health in California. And in 2016, down below, that's when California passed Prop 56, which is tobacco tax, and part of that money was earmarked for oral health specifically. In 2017, we published the California Oral Health Burden Report, and this gives a lot of information about the status of oral health throughout the state, letting us know where we're doing well and where we need to improve. In 2017, the local oral health program started, and I'm going to talk about that next. And in 2018, under the direction of the dental director, they created a California Oral Health Plan. And so this is a comprehensive 10-year plan that looks at our priorities in oral health and how we can address them as a group to improve oral health of the population. In 2021, we have the California Partnership for Oral Health, which brings in additional partners that work in other communities or social service agencies or different areas that aren't specific to oral health, but it helps broaden the audience and the number of people that are concerned about oral health. So now I'm going to go into a little more detail about what the local oral health programs are. So that tobacco tax created funds for local oral health programs throughout California. There's 61 LOHPs. They're usually known and labeled by county, but there are some that are more cities. And their goal is to create and expand capacity through workforce development, disease prevention, community clinical linkages, and surveillance, with the vision of impacting health disparities, improving utilization of dental care and healthcare, lessen oral disease burden, and lessen emergency room visits for non-traumatic oral health issues. They are all throughout the state of California, and each one's really different. Some of that difference is due to how big or small they are, and some of that difference is due to their community that they serve. They have a benefit of being able to have a lot of flexibility in the work that they do, and so they can tailor their goals and their activities to best meet the needs of their local community. Next slide. And so from the Office of Oral Health, each local oral health plan, or LOHP, has a work plan. And that work plan covers many areas in the California Oral Health Plan generally, but it has a big carve out for preschool-aged children and elementary school-aged children, because we know the sooner you can work on prevention and creating good habits, the bigger impact you can have over the life course. And so I just copied a few points here from their work plan to show you some of the things that is under their plan. So this includes care coordination using 5A strategy for addressing oral health problems in preschool and school-age children. begin planning for school-based or school-linked programs, design of an early education and care prevention program, for example, toothbrushing programs in pre-K or preschool, and oral health education. And a big part of what they do is reach out and create partnerships throughout their community, all different kinds of partnerships with different kinds of organizations to help everybody understand the oral health situation in their local area and work together from all different areas. And so many LOHPs work or are trying to work with Head Start and Early Head Start organizations as important organizations in their community. You can go to the next one. I will just add one more thing, which is that each LOHP is very different and oftentimes very flexible. So there's no two that are exactly the same. All right, I'm going to now pass it to Riston Woolley and Chris Cochran from Head Start to give us a brief overview of what is involved in Head Start.
Great. Good morning, everyone. Thank you for having me. Next slide, please. I think, there we go. So for those of you who don't know me, because I see lots of friendly Head Start faces, welcome to a new space for some of you. My name is Riston Woolley, and I'm the director of the California Head Start Collaboration Office. I'm here to give a brief overview of Head Start funded programs and a high-level overview of the services that they provide. Next slide. So my office, the collaboration office, doesn't provide any direct services to children and families. I'm really kind of like a party planner for Head Starts and state partners. So my office is housed in the Department of Social Services within the Child Care and Development Division and is a mighty party of two. So as you can see on the screen, I have my program analyst, Bree Rude, who really keeps me together in everything that happens on a daily basis. So I'm very thankful for her. So as required by the Head Start Act, collaboration offices are funded by a grant, just like Head Start recipients are, from the Administration for Children and Families. And we're really here to create a visible presence for Head Start programs at the state level and assist in the development of multi-agency and public-private partnerships through Head Start funded programs and other interested stakeholders. There's one in every state and territory, as well as one national office for migrant and seasonal programs, and one national office for American Indian and Native Alaskan programs, which we also collaborate with. Next slide. So as you can see from the slide, because I don't provide services for children and families, I'm really a systems person. So Head Start collaboration offices really strengthen early childhood systems at the state and local levels, making sure that we can improve access for those programs that are providing supports for children and their families from ages birth through entry to school, whether that's transitional kindergarten or kindergarten, and encouraging the widespread collaboration between Head Start programs, services, and initiatives. So that's one of the reasons that we're here today. As you'll see later in the slides, oral health is a big part of Head Start programs as well. So Head Start programs don't just provide childcare services, it really is a comprehensive service model that they provide with lots of requirements. Next slide. So I'm just going to give a brief introduction of Head Start services. Many of you may work with Head Start programs, but just to give a larger picture of what Head Start is in the communities and how it varies from pretty much agency or site location to site location. So Head Start programs are not funded through the state necessarily, unless they're receiving state-funded child care funds. The Head Start program funds are a direct federal grant to local organizations to provide that early education and comprehensive services. Head Start was designed to break the cycle of poverty, providing preschool children and of low-income families with comprehensive programs to meet emotional, social, health, nutritional, and psychological needs. So our programs through Head Start provide a variety of services through early learning and development. And some examples of those are really recognizing the parent as the first and most influential teacher, In the education and development space, they do ongoing screenings and assessments to ensure that the child is making progress while collaborating with the parent and other community agencies. In the health and wellness space, some of the examples of services they provide, of course, is receiving medical, dental, hearing, vision, and behavior screenings. And of course, we teach children how to brush their teeth and promote oral health and hygiene. And then we also service the children and families in their behavioral health needs. Of course, family engagement is a really big part of Head Start services, so much so that we have a full parent, family, and community engagement framework that our staff and providers follow. And then, of course, we know for family well-being that when families are healthy, safe, and economically stable, their children's health and well-being can thrive. Family well-being is one of the number one important outcomes for family in our system. So one of the ways that Head Start programs support family well-being, which I always enjoy talking about, is assisting families in identifying and reaching their goals and dreams, including those related to finances and economic mobility, housing, employment, and education. And a fun fact is we also provide career pathways and early education. So about 25% nationwide of our program staff are also former Head Start parents. So really completing that cycle. Next slide. So we have several different program types to reach children and families who need Head Start services. Our programs really tailor the need to the families in the local service area that they're providing services to. So we provide that in a variety of different things. I'm sure everyone is aware of Early Head Start, which is a program that is birth to 2 years old, and then Head Start. And this last year, in October, 2 years ago in October, we have now been renamed that to Head Start Preschool to really differentiate the preschool services from 3 to 5 years old. So what you'll start to see out in the field is we just call it Head Start funded programs, which includes all the services underneath the Head Start Act. So that's a bit of a shift. So our programs can provide services in any one of these ways that are listed on the PowerPoint slide, where you have center-based services, which are typically in a center-based classroom licensed by community care licensing, and really looks like a classroom setting where those comprehensive services are provided on site. We also provide home-based services, which a lot of people may not be aware of, which are delivered in the family's own home, along with planned group socialization activities. These services are provided typically in a weekly home visit and focus on promoting the parent's ability to support their child's development. Of course, we have the wonderful Early Head Start Child Care Partnership, which is a really unique model that brings together the best of early Head Start services and other child care programs funded by non-Head Start dollars to provide those comprehensive and continuous services, which really is a partnership. And then we have locally designed services, because you never know when you build policies what people are doing in the field or what the need is. So this really is a service delivery model that is provided through some combination of the above settings and really depends on the need of the community. Next slide. So here's the amazing piece of this. Head Start programs are required to follow the Head Start program performance standards, also referred to just as performance standards or regulations. It's a 133-page document that ensures Head Start programs meet all of the federal requirements. In addition to the federal Head Start performance requirements, programs are also required to meet many state and local laws. For example, Head Start programs meet California Community Care Licensing Standards, local fire marshal requirements, and regulations set forth by the California Department of Social Services and/or Department of Education for funding that they received in blending and braiding funding. I think next slide. Okay, so I will now hand it over to Chris Cochran. She is a great partner of the office and provides lots of wonderful services in the field. She oversees a statewide early Head Start childcare partnership with the California Department of Education, and she'll go more into depth into the regulation requirements specific to dental and oral health. Chris?
Thank you, Riston. Yes, thank you for leading us into the regulations. The regulations, the performance standards, as Riston said, really are our guiding light, and they direct us into what we are required to do for all of our services. And so we are going to focus solely in the next few minutes on the oral health services requirements. Next slide, please. So one of them, and this is a fairly new priority for the Office of Head Start, our administrative office in Washington, D.C., that programs must obtain a determination from a healthcare professional. This can be a hygienist, this can be a dentist, as to whether the child is up to date. And I've highlighted in yellow the oral healthcare services, and using our dental periodicity schedule in California. So the next slide, please. This is our dental periodicity schedule that we are required to use, and this indicates that beginning at age 1, a child is referred to see a dentist. Also, it says there, you'll see in the middle, routine dental referral every 6 months thereafter. This is the requirement. We know best practice and the American Dental Association, California Dental Association recommend that the child see a dentist first tooth or by 6 months. So that is covered by Medi-Cal as well, and most dental insurances. So that's what a lot of programs are following, that 6 months or first tooth. Next slide, please. We also are required to make sure that the children are up to date. So we have children that enroll, as you know, probably 2, 3, excuse me, 4 years old. And so they've missed that dental home. They've missed the dental examination. So we are required as a Head Start program to bring them up to date, as you can see, as quickly as possible. So there's a little bit of urgency there to get that child in for care because they may only be with us for a year. Next slide, please. Then the ongoing care, and that's that periodicity schedule. So we are required to have families follow up and get the ongoing care for their children, that every 6 months care. And also you'll see there, facilitate and monitor the necessary treatment and follow-up that is needed for children based on their dental examination. And the next slide will show a little bit more around the requirement for follow-up. Next slide. So we must facilitate. So we're supporting and helping. Most programs have what's called a family advocate or family service worker, kind of like a social worker that supports families in getting the testing or evaluation needed. And this is both for medical and dental. Then also, though, we must have a follow-up plan. So that's often in the dental world, that's the treatment plan that the dentist provides. We must have that. We must track and monitor that. And you'll see a little bit later that we really must ensure that that treatment has begun. Next slide. Also, considerations are we have monitoring that is done by the federal government, that's Federal Head Start, that comes out to our programs. And these are done twice in a 5-year grant period. So we have what's called a Focus Area 1, which is virtual and in person, and they will come out and monitor. And specifically, we're looking at them monitoring the quality and consistency of services provided to families, including dental. The Focus Area 2, that's a little more specific. They do a deeper dive into looking at data, and they're also looking at the oral health care within 90 days of enrollment. So has a child had a determination if they're up to date on oral health care, and also looking at the dental examinations, are those completed? Next slide, please. We also have every August 31st, our program information report is required to be uploaded and sent to the Office of Head Start in Washington, D.C. These are not regulations, but these are reporting requirements. So we want our reporting to look as best as it can. And so the next slide will show the screenshot from the program information report that we are required to submit around oral health. And you'll see there, that first is really the dental home. So we are required to have families establish a dental home. And then also the dental examination, and then the treatment. And you'll see there the number of children that have received treatment. So there's some pressure for programs to make sure that that is a high number in our program information report. Otherwise, we get a lot of questions from our program specialists. Next slide. Also, this is what Riston was really focusing on, is the to families. And this is where a lot of the LOHPs supporting our programs in providing training. So this is one of the performance standards that we are required to provide opportunities for learning about oral health care practices, and also the piece around healthy eating and the consequences of sugar-sweetened beverages. Also, as Riston mentioned, the programs are required to have their children brush their teeth at least once a day in the classroom. And again, this is where LOHPs have really supported around the toothbrushing kits and learning information for staff and families and our children. So trainings and material for our families. Next slide. So a summary of Head Start requirements. Within 90 days, a determination must be made by a registered dental hygienist or a dental hygienist in alternative practice or a dentist. Any of those can complete that determination that the child is up to date. Then a dental examination is required with a treatment plan if needed. And then the treatment plan must be on file, and the dental examination must be on file. Next slide. Okay, I am going to turn it back to Kristen. Thank you.
Great. Thank you guys so much for that great overview of Head Start. Now it's going to be Vaishali, and myself talking about KOHA, which is the Kindergarten Oral Health Assessment. Go ahead, Vaish.
Thank you so much, Dr. Hoft. A very pleasant good morning, everyone. It's truly a pleasure to present to you all today. I am Vaishali Sundararajan from Office of Oral Health, working on KOHA program. Next slide, please. Now we'll review kindergarten oral health assessment requirements and how schools report data. Next slide, please. I'm sorry, the previous slide. Yep, good. California's Kindergarten Oral Health Assessment, or KOHA, is grounded in state law. It started with Assembly Bill 1433 and was strengthened by Senate Bill 379 and Assembly Bill 2630. These laws are now codified in California Education Code. So what does this mean for schools? Every child entering public school must have an oral health assessment once between transitional kindergarten and kindergarten, or in the first grade if that's their first year in public school. This is not an annual requirement. It is a one-time screening to ensure that children start their school healthy and ready to learn. Finally, all the KOHA data is reported centrally through SCORE, the system for California oral health reporting, which helps the state monitor compliance and identify gaps. Next slide. So California has invested in improving KOHA over 20 years, and let's look at the timeline. In 2005, a bill was passed that established KOHA program under Education Code. In 2006, a statewide kindergarten database was created to track compliance. In 2017, Senate bill allowed schools to use passive consent for screening at school events. This made the participation easier for families. In 2019, SCORE was launched, and this is a centralized reporting system for KOHA data. Most recently, in 2024, Assembly Bill clarified that transitional kindergarten is included in the definition of kindergarten. So TK students are part of KOHA requirement. This timeline shows how California has constantly refined KOHA to improve access, streamline reporting, and ensure all children are connected to dental care early. Next slide. This slide and the following 3 slides show the exact language from EdCode. Next slide. So in simple terms, every child entering public school must present proof of oral health assessment by May 31st of that school year. And importantly, the law defines kindergarten to include both transitional kindergarten and kindergarten. This proof is required only once during the 2-year period, that is the TK and the K program. So if a child is screened in TK, they do not need to repeat the screening in the next year, that is kindergarten. Next slide. The previous slide. Thank you. The oral health assessment must be completed by a licensed dentist or a qualified dental health professional operating within their scope of practices. And this dental assessment has to be performed within 12 months prior to the student's initial enrollment date. Now I'll pass it on to Dr. Hoft to walk us through the next section. Thank you.
All right. Thank you, Dr. Sundarajan. Thank you for going over sort of the letter of the policy. And now I'm going to go a little bit more into kind of the intent. So the goals of COHA are simple but powerful. We want to promote school readiness by reducing absences and making sure that every kid is as healthy as they can be. We want to identify untreated dental disease early and help families connect to a dental home. The benefits of a dental home are that the child has a regular source of dental care and they can go for regular checkups, which helps identify any potential problems early before they become bigger problems. And it also helps with prevention so that we can avoid any problems starting at all. And generally provides education for the child and their family about best oral health and hygiene practices. One of my first oral health projects was interviewing families in the Bay Area about their children's oral health, and many mentioned that their Head Start screening or their kindergarten oral health screening was the first time they knew they had to take children to the dentist and that baby teeth needed dental care. So these are really important policies. All right. Next slide. This is a very simplified overview of the COHA process, but I just wanted to let you know how it works. It starts with the form. There is a standardized COHA form that's usually sent home to parents or completed during the school screening. It comes from the school. And then a licensed dental professional fills out the form, and usually schools collect it. And then that data gets entered into the state's reporting database or SCORE, usually by the schools or school district, but each area does it slightly differently. And this whole process aims for us to have accurate statewide data on oral health. Next slide. And this slide is very busy. It's just meant to give you an idea of all the different players that can be involved in the COHA process and how the COHA process can be different across schools or districts. So we've got dental professionals who are completing the forms, parents who are maybe providing the consent and returning the forms if they're taking it to a dental office, or maybe the school is running a screening day. And all of these parts need to come together to get the information onto the forms to the school, then the data needs to be entered into the system. Next slide. All right, so if you're interested in what the COHA forms looks like, this is where you can find it on the COHTAC website. We have the latest forms there, and it's available in multiple languages. It occasionally changes, and we will update the forms on this page if there are any changes. Next slide. Yes, and Khadija also put the link in the chat to make it easier. So the form has 3 sections: child demographics, assessment results, and follow-up or waiver details. And we aim to have all of the sections complete. Next, I don't have time to go through the form in detail, but you guys can look at it. And then in summary, a lot of times people wonder what are the differences between the Head Start requirements and COA. And there's more detail and nuance than I'm able to fit in this slide or just in the minute that I have. But here I attempted to summarize some of the key components. We've got Head Start on the left and COA on the right. So you can see some of the differences. So Head Start starts with a determination if the child is up to date on their dental periodicity schedule. And if so, great. If not, they need a dental exam and they need it to be on file. The treatment plan needs to be followed up on. And just as a note, if the child is enrolled in early Head Start, which is 0 to 3, when they go into regular Head Start, which is 3+, then they need a second oral health exam. And for COA is that first year of public school, usually TK or kindergarten. It has to be done by May. And it's a screening. It's not an exam. So it's a screening by a dental professional like a dentist, RDHAP or RDH. And then the treatment follow-up is on the form. And there's one assessment for the whole TKK experience. Next slide. This is reporting the data of how many children are getting their COA data submitted. So you can see we were actually doing pretty well before COVID when it was peaked up there. And then we went down, we're working our way back up. We're getting close to our 35% target. And so this is showing COA can be really difficult. And so we're working hard to get as many children screened and get their data collected and in so that we can use this tool to reach all the children and to help get us some data that can help us understand the population health in California. Next slide. All right. So now we are excited to hear from 4 counties about the great work happening through their local oral health program and Head Start collaborations to support children's oral health. We're going to start with Madera County with Evelyn and Myra sharing about their experiences.
Thank you, Kristen. Just like Kristen said, my name is Evelyn Ramirez. I'm a health education specialist at the Madera County Department of Public Health under the local oral health program. And here with me, I have Myra Gonzalez, which is a health services clinic specialist at the Community Action Partnership of Madera County, the Head Start program. Next slide, please. This is just our department's vision and mission to lead, protect, and empower. Next slide, please. So I'm just going to share a brief background on how our partnership started. So we are currently part of the 2022-2027 5-year oral health program, and we were also part of it in the last cycle, which was 2018-22. And then since the last grant cycle, our team has been working to implement the kindergarten oral health assessment, or the KOHA, at the Madera County schools. So as many of you know, heard today, the KOHA is required by California law, and also, providing oral health education to children and to the parents or caregivers. And then because every student enrolled in public school must complete a dental checkup during the first year of school, we started thinking about how could we, reach families earlier and just make the process smoother. So back in 2023, a former team member reached out to a staff member at the Head Start, and that's how our partnership began. I believe, if I'm not mistaken, we actually started going into the Head Start the following year, so 2024. And since Head Start services children who will soon be entering TK or in kindergarten, and allows us to provide dental assessments ahead of time, and with the support of our dental hygienist alternative practice. And then, like it was stated earlier, Head Start also has some dental requirements, so this partnership really aligns with both of our goals. Right. Next slide, please. I'd also like to briefly share what our collaboration with Head Start looks like. So we usually provide oral health education for both parents and caregivers and children. For parents, we facilitate workshops on brush book bed campaign and rethink your drink, which usually happen during the parent or staff meetings. And then with support from our contractor registered dental hygienist alternative practice, we have visited the Head Start sites to conduct oral health assessment. We usually do send the consent forms to the school coordinator, which in this case is Myra, and then the school coordinator sends them to the teachers or family advocates. And then consent forms are usually sent home 1 to 2 weeks in advance, and then only students with signed consent forms are seen. And then depending on the authorization, children may receive an oral health assessment only or an assessment with fluoride varnish. And then usually the RDHP completes the intake form and provides assessment for children entering TK or kindergarten. And then she also provides a short oral health education to children, and they all receive a toothbrush kit that includes like a toothbrush, toothpaste, sand timer, and a book. Next, and then now I'll pass it over to Myra.
Thank you, Evelyn. So I just wanted to share that also for our collaboration with the health department has been essential in expanding access to dental assessments for the children in our Head Start program, especially for our centers that we have up in the mountain area of Madera County. So while families do have a dental home, some families do face barriers such as distance and access, often preventing children from receiving timely care. And through the collaboration with the health department, we worked closely with the families to obtain consent and ensure they understood the importance of these assessments for their children. And then our classroom staff prepare the children ahead of time. So when the registered dental hygienist came in, they felt comfortable and had a positive experience. And by bringing the oral health assessments directly into our Head Start centers, we were able to identify concerns on early and connect families to needed care. Next slide.
Thank you. Actually, can you go back to the last slide? Sorry. The previous one, sorry. Yeah, that one. Thank you. So program objectives, we both agreed on long-term and short-term changes. So for all children to receive the dental care they need and reduce dental decay, and then to provide linkages to dental treatment services. An example would be like trying to reach individuals or families with no insurance or those who live in rural or underserved areas. And then for short-term changes, to improve oral health assessments and increase oral health education to children and caregivers, such as providing materials that are easy to read and understand, which can help a person make a good decision of their oral health. Right. Next slide, please. Thank you. And then just some challenges and growth opportunities that we've been through. It's important one was we want to try to implement an electronic referral system that's compatible with all partner systems. Also improving the KOHA return rates in all school districts in Madera County. We believe that like we see children as early as Head Start, then we can improve oral health education and KOHA rates in all school districts. And also it's been difficult for the RDHPs to see all students. There's no other dental staff on site or employed, and this can, affect the number of children being seen. And that concludes our presentation. Thank you for your time, and I'll pass it over to Kristen.
Thank you. We are now going to hear from Santa Clara County, where we have Brandy, Criselda, and Samaya.
Thanks so much. I'm Brandy Matson. I'm a hygienist and the Health Planning Specialist 3. I'm here with my manager, Samaya, and our Head Start champion, Criselda, from the Family Head Start Early Learning Services from Santa Clara County. Thanks for having us. Next slide. Our model for supporting our programs is pretty simple, and we've been a partner with Head Start for quite a while. Samaya will get more into the detail of that, but this is our model for us supporting the programs, the families, and the children in our community. Next slide. This is our team currently. We have Samaya, myself, and then we have a health education specialist, extra help, and a volunteer UCSF dental public health resident, very part-time. So it looks like a large team, but not a lot of hours, but we do work well together in our program. And there's our websites if you would like to know where our websites are. Next slide. Some LOHPs are housed in different parts of their public health department or in their county, and we're a part of the we're housed in the Healthy Communities branch. We're one of 11 programs in this branch. Some LOHPs are structured within other branches, and we're currently undergoing some shifts in our department due to the budget cuts from the federal government. But we are a part of the Clinic to Communities linkages team and have a close relationship with diabetes prevention, Healthy Brain, and now CalFresh, Community Nutrition, and Climate and Health. Next slide. What we do for our in our LOHP is we do a lot of I know this is a lot of text, so our apologies, but this lays out some of the areas of focus that we have at our local level. Most of our school district partnerships with Head Start include Train the Trainer, parent education materials, and school-based programs. So that's mostly what we do with this level. Next slide. With our model Train the Trainer, we often call it Oral Health 101. It's designed specifically for audiences. It's tailored to each individual audiences, and it's an integral part of our workforce development strategy. We want to strengthen the workforce to train their communities, and that's very much a big key to our framework. We're a county of about 2 million people, so you can imagine it's pretty challenging to do this. We're currently exploring new ways to build oral health literacy in our county. Next slide. We also do a lot of other creative projects. So here's some examples. We definitely make it a little bit bigger in February and October for campaigns like Children's Dental Health Month and National Dental Hygiene Month. We're a big part of planning with events. We do a healthy Happy Teeth event every year where we promote KOHA, and we do this with our close partnerships in the county. We do social media, so check us out on Instagram, Facebook. We have newsletters quarterly, at least quarterly. We help with translations with some of our partners in the community if they need materials in different languages. We also do a lot of parent and caregiving educational materials. The one listed on the right there is actually something we've done with WIC. We have a very close relationship with that program as well as Head Start. And then we like to provide incentive charts as well if needed. Next slide. We're one of a few counties that are involved in state level work group work. And through our terrific partnership, of course, with COHTAC and UCSF, we've been able to provide guidance and build statewide tools regarding KOHA. Our most recent project as a work group was working on TK through 12 state standards for education, as they pertain to oral health. This is kind of a cool other thing that we do on the side. I'm going to pass it on to Samaya now, who's our manager, and she's going to talk a little bit more in depth about our partnership with Head Start.
Thanks, Brandy. Next slide, please. So hi everyone, I'm just going to talk a little bit about how we partner, not just with Head Start, but in general, how we do our partnerships. So when organizations partner with us, they usually reach out for specific asks, and usually we have a common vision or goals in our scope of work that complement each other, usually surrounding promoting oral health across our communities, especially children. So together we often build an action plan, and most of the time it can be focused on smaller projects like we've done previously with Head Start and WIC and others, like a parent education material or staff training or outreach component of some sort. And the project usually benefits, both programs and, communities. Often the partnering organizations help promote the work of the oral health program. And since our oral health program usually sets goals and objectives, utilizing the SMARTY goals, which are listed here. So when we work together, we try to reach these goals and agree to promote the work to other partners and refer to others if appropriate. So with Head Start has, of course, been mentioned by our local partners and by our state as leaders in this oral health work, as you all saw through this all these amazing presentations we just heard. They're consistent in ensuring that their children have dental access, and many offer brushing programs on site. So we really, really appreciate the partnership with them and their enthusiasm as we work together and partner on this important oral health work. Next slide, please. So here are some ways that an LOHP can partner if you have not yet started partnering with your local Head Start sites. There are co-promotion events. We try to do one annually. We're working on our 4th annual Happy Teeth event this year.
which is really around promoting COHA, screenings, and Head Start was a major partner in not only promoting, but attending the event as a vendor. Our Brush Book Bed campaigns, we have a great inventory of resources surrounding the importance of Brush Book Bed that we've shared. Brush in a Box project, if programs have capacity to do that, as well as staff trainings for teachers, caregivers, students, and educational materials, of course. And then connecting to local organizations and resources, as well as school-based screening. So I know previously our partners at Healthier Kids Foundation used to provide screenings to our local Head Start sites, but unfortunately, due to budget cuts, we learned that, there have been some transitions there. However, just really connecting to resources and local partners. Next slide, please. In terms of topic ideas, I know Brandy touched a little bit about our Oral Health 1 curriculum. So we found that these are really easy topics to really start those collaborations, whether it's around oral health and nutrition, oral health and mental health, oral health and accessibility, oral health and student performance, and pregnancy, and around foster youth. So these are great topics to really dive deep into with Head Start partners and so forth. And then also, just areas or who to reach out to start that coordination and collaboration. Next slide, please. This is an example of our Brush Book Bed campaign work that we updated internally. So we use resources like this for our partnerships. We've done this with several of our partners, including Head Start, WIC, our Valley partners, our health and hospital system. And we're currently in the process of doing another collaboration with our local Head Start this spring, utilizing this campaign. And we're doing a training for their staff for this afternoon. Next slide, please. And so here's some additional notes about how our Head Start partnership works. Previously, we were doing streamlined trainings for all sites, but we've, just due to capacity, we've now streamlined it so that we present for all sites at the same time simultaneously rather than individual site trainings. Our next training, like I mentioned, is today. And I also joined the Head Start Services Advisory Committees to learn more and stay in the loop with Head Start. And also the Head Start Program Manager actively joins our oral health program stakeholder work group and has been active with our needs assessment process and so forth. Next slide, please. So I really want to take this opportunity to highlight one of our local key partners, Griselda Gonzalez. She's the Head Start Families Health Services Supervisor and has really been an oral health champion since 2019. I met her in 2014, so we've known each other for a while when I used to work in nutrition, and we really appreciate her support and her dedication around increasing oral health awareness and the impacts of poor oral health on our communities. She's also opened up so many opportunities for us to partner with Head Start sites and community-based organizations like the Healthier Kids Foundation during the pandemic, where we provided fluoride varnish for students. Our partnership is built on trust, alignment, and mission, and we serve the community through family awareness and shared vision. So with that, I want to ask Griselda to please join and present the next couple slides. Thank you.
Thank you, Sumaya. And what can I say? Ditto, it's reciprocal feelings with our local oral health program. It has been such a great team effort to work collaboratively with our local oral health program. It really aligns with our mission, our views, and just what Head Start really stands for, serving families, community, children, providing education, and just with Head Start's views in how we really encompass comprehensive services and making sure that everything is full circle. I couldn't do what I do without them. And they're just a wealth of knowledge. So some of the areas where we really collaborate, as I mentioned, is really ensuring that everything is a full circle. We educate children in the classrooms by providing basic oral care tips for kids, especially serving preschool 3 to 5, and also our early Head Start children and families too, and making sure that information for children is age appropriate. but also ensuring that our children are toothbrushing at school and how they can really make that connection from home to school. Educating families about the importance of routine exams. We also have our family advocates who participate in the train the trainer. They'll be receiving their training this afternoon, as mentioned earlier, and really ensuring that they have the resources they need to be able to support families on site as well. Another key component that has been such a great benefit of working with the local oral health program has been making sure that nutrition and oral health are connected, because healthy children can have a healthy learning journey, and really seeing and teaching the importance of the nutrition that we intake as families really promotes our oral health. Another key component has also been our kindergarten transition. And that's once again, bringing in the full circle of how education and comprehensive services and community awareness and an educational journey are all tied together. This is where we also in January start to promote the transition to kindergarten for our graduating children and ensuring that families have the opportunity to get their KOHAs. This is where we start to promote the form and explaining how the process works. Next slide, please. So as mentioned earlier, a Head Start program must promote effective oral health hygiene by ensuring all children with teeth are assisted by appropriate staff and volunteers, if available, in brushing their teeth with toothpaste and containing fluoride once daily. As mentioned before, our children in all of our classrooms have this opportunity. They are brushing their teeth after breakfast, and it's such a pleasure to see how they really take pride in having their own toothbrush at school and sharing what they've learned. And this goes back to what our local health program has been able to assist us with and providing that support. Some of the other key components that really tie into our collaborations are the staff and parent trainings that come together. As mentioned, our family advocate training, Train the Trainer, will be taking place today, but we do this process yearly so that resources are refreshed, and we always come back and tie how important oral health is important and connecting overall health, but also providing our parents with the same type of education opportunity to learn more about overall oral health care and our community resources. Our oral health collaborative also participates in our health and mental health advisory committee, which are quarterly. They provide support and resources, but are also our champions in brainstorming together and creating new standards and also opportunities for growth for all of us. Another component is our Happy Teeth. We are big advocates for the Happy Teeth annual event in our community in Santa Clara County. We refer all our families. This is opportunity for them to have their KOHA for the kindergarten transition, so continuing those efforts. But it's also provides an opportunity for us to refer our families and to learn about other community agencies out in our community. They get to meet other parents, other children meet each other, but it's also all a form of recruitment for our Head Start agency here in Santa Clara County. This year, we'll also be participating in the Brush Book Bed campaign and bringing back and tying together education and comprehensive services in helping educate our families and establishing healthy routines. And it's just an overall great learning opportunity. Next slide, please. Here is a little bit of information about our website. We have also on here a page for our early Head Start. We have several programs under our umbrella with the Santa Clara County Office of Education. And as mentioned earlier, just thank you everyone for this wonderful opportunity to speak about our collaboration. As mentioned, we couldn't do what we do without each other in promoting healthy awareness in our communities. Thank you, everyone, for your time.
Thank you so much, Griselda. I really, really, really appreciate you. Just wanted to quickly just share our webpage. We have a public facing page and a provider page for more information and resources. Next slide. And then the last couple of slides are just our bios for your reference. And then our last slide is just thank you. So thank you so much for, again, this opportunity, as Griselda mentioned. We really appreciate it. And please let us know if you have any questions. Thank you.
Thank you, guys. All the slides will be included in the event webpage at the end. So if we don't get to absolutely every slide, you can always go back and read the details or click on links and stuff. Well, thank you very much, Santa Clara County. We're now going to hear from Solano County.
Rosario.
Yeah, they just need to pull up the slides.
Rosario and Carol.
Hi, thank you for having us. My name is Rosario Manjares, and I am the project coordinator for the Solano Oral Health Education Program and Health Education Specialist. This is building bridges for children's oral health, the partnership between the Solano Oral Health Education Program and the Napa Solano Head Start. And it's a story of collaboration, trust, and impact. And I have alongside with me Carol Ash, which is our registered dental hygienist. Next slide, please.
Okay, I am the registered dental hygienist with our program, and I have been doing this for over 30 years. And I've been going to Head Start and going to their sites, providing services to the children with the most need in our community. Next slide. Next slide. Okay. I work with the head director of it's the Napa Solano Dental Child Start program, and she's been very supportive. She's also on our COHTAC committee, and I am also on their health and mental committee, which meets regularly. We bring the coalition. The coalition helps bring public health leadership, community advocates, early childhood educators, oral health experts, and Solano school nurses. And we meet together quarterly, and we're trying to improve the child's oral health, promote prevention, reduce childhood caries, and provide services to families most at need. And it's a rather large committee that gathers. And lately we've been doing it on Zoom and not having to go to an office. Okay. Next slide. Next slide. Oh, okay.
No, go back.
Okay. Because of all our discussions during the committee meetings, we share the data, and both organizations recognize a natural partnership opportunity that could significantly impact children's oral health. And the partnerships are the same target population, both serve families with young children, trusted setting. Head Start provides a safe, familiar environment for services, and complementary missions. Both organizations prioritize education and healthy habits, and leverage existing on the infrastructure and family relationships. Next slide. Okay, as a professional RDH, I've been providing dental screenings, fluoride varnishes, and parent education on a regular basis. I try to go out to each site twice during a school year. The Head Start staff does do all the coordination of whatever from my screenings, and they provide the oral health lessons because I've educated them over the last 30 years, and some of them have been there that long. And they are brushing every day in the classroom, and I'm observing them when I'm there to make sure that they're brushing correctly. And we send home goodie bags that have information for the parents, and then also toothbrushes are included in the bag, so that we know that each of them have their own toothbrush, because we have heard of them sharing at home. Next slide.
And I'll take it from here.
Okay.
Carol. So
Thank you.
it is a natural progression, bridging the gap. There's no extra transportation needed for the parents. It's a basically one-stop shop. There's no missed work for the parents or guardian if they get their child screened from Carol. Again, it's a familiar, trusted environment. There's no cost to the family. This is 100% free. And then just school readiness, healthy teeth support better nutrition, speech, learning, and just so much more. Next slide, please. And so just our impact, from at a glance real quick, Carol screened 258 children, 210, she applied fluoride varnish, 15 head sites were visited, and 46 classes participated. And as we could see, it's just an increased access. More children are receiving those preventative services. And as I mentioned before, just reduce barriers. So we eliminate, transportation time obstacles and just so much more, and the family just gets supported, just education resources that the family needs. Next slide. And then this was our vision and mission for SOHAC. We just envisioned that all Solano County residents enjoy good oral health, which will positively impact their overall health. And then just the mission is that our SOHAC committee strives to improve oral health, especially among the most vulnerable, through collaborative efforts and planning, implementation, and coordination of public health interventions with community partners. And we feel we do that with the Head Start partnership. So thank you. Thank you, everybody. And I'll pass it along to the next.
Thank you. We've got Tehama County now.
My name is Jenna Roof. I am with the Tehama County Public Health Department. Hannah is having some technical difficulties, so I will be sharing on her behalf this morning too. But we're both with the Tehama County Health Services Agency, and I'll be sharing about our partnership with First 5 Tehama. So next slide. We first just wanted to start with some background, and many people don't know where Tehama County is or need a refresher. So we just wanted to start with a little map. Tehama County lies approximately midway between Sacramento and the Oregon border. Largely rural, Tehama has identified access to healthcare, including dental, as its top priority in the 2025 Community Health Assessment. So as you can see, we have a couple bigger areas, Corning, Red Bluff, right along I-5, but then a lot of Tehama County is more rural, off the beaten path, as you can see, like Rancho Tehama, Paynes Creek, up 36 in the mountains, or out towards the foothills, more rural areas. So we do have a population of 65,000, but over 4,823 miles. So a bigger area for not as many people. So in those more rural areas, we are hearing people sharing toothbrushes or students and children only brushing once a week. So with that limited access to healthcare, we're really focusing on education and providing books, education, and toothbrushes for those in need. Next slide, please. So in partnership with First 5 Tehama, I see our formatting kind of got mixed up a little bit, but it's all there. We partnered and did books for businesses. So we got different baskets and books we've been giving out along with information on the Dolly Parton book program and just different oral health books. I'll go over on the next slides on what we put in the baskets, but books are in businesses around the community for free to families. My own personal dentist has a basket in there, and last time I was in the dentist, I saw children taking books. So really awesome. We just continue to make sure those are filled and providing brushing information and different tips and everything in those baskets as well. Next slide, please. So here are some of the books we have in the baskets. The Night Before the Tooth Fairy, Little Dinos Don't Bite, I Brushed My Teeth, and then The Night I Forgot to Brush. We've also been going around and doing library readings. and different readings to students and children around the communities. So that's one of the ones we've been reading for that event as well. Next slide. Potter the Otter, of course, Tale of Water, so we can promote Rethink Your Drink as well. We also have Potter the Otter Visits the Dentist, the Back to School one, focusing on nutrition, 2 different tooth books, and then Happy Teeth for babies as well. Next slide. We also have got Dolly Parton's Imagination Library. It's eligible for all Tehama County residents, so not based on income or anything. That Dolly Parton program sends every child up to the age of 5 a free book every month. And I've heard even some coworkers here that are here in my office, they have it for their children. And then we also have little libraries around Tehama County. So after their children read the book or are ready for their next book, they pass it along so other children can read it as well. Or I've heard of some other people like donating it to the library when they have free book exchanges. So everybody's getting books to really focus on that the brush book bed program as well. So we've partnered with First Five for that. And then as we continue our partnership, some of our future plans, we'll keep those books for businesses, those baskets alive, and making sure those books are rotated into little libraries as well, so they can reach as many families as possible. First Five has asked us to participate in some of their parent nights, so education, providing toothbrush kits. Right now we're in our pilot program for Brush in the Box. We're just in a couple local schools with older kids, but we've thought about working with Head Start on Brush in a Box as well. Promoting Rethink Your Drink. We have members of First Five as part of our dental committee. And then we also had our needs assessment focus groups for this cycle for our grant, and some First Five representatives were there for the home visiting focus group. So we got to learn about some of the families they reach as well. And then also for National Children's Dental Health Month, they're helping us share information and reach families that they work with as well. Next slide. Well, Hannah and I are both like very new to the program. We've both only been here a few months, so we mainly just got to share what's already been happening, but we're both really looking forward to continuing those partnerships. And we've provided our email if you have any questions, and we can answer any questions in the chat as well.
Great.
Thank you so much.
Thank you so much.
Thank you.
I am now gonna pass. Well, first of all, I want to give a big round of applause to all 4 of the counties who presented. We really appreciate you taking the time to share your amazing work. And it's really nice for everybody to see how it's handled differently in different places and all the different ways that partnerships and collaborations can look. So thank you all so much for taking the time to share. We are about to close out, so I'm going to go ahead and pass it to Janelle, who's going to give a quick overview of some resources and upcoming activities, and then we will try and answer as many questions as we can.
Thank you so much. So because we're running a little behind, instead of reviewing all 15 slides, I just will briefly say that we have some key resources available to support collaboration between Head Start programs and LOHPs. Your best starting point is the COHTAC website. There's that research the education resource tab that you can find that's everything is searchable. There's also the Brush in the Box toolkit for classroom toothbrushing, complete with age-based guidance, sanitation steps, family checks, checklists, ordering information, and a recorded webinar in English and Spanish. We also have early childhood resources like videos, games, coloring sheets, nutrition tips, plus dedicated support for KOHA, including tools and training recordings. For local connection and care access, we've included links to find your local oral health program, help families locate dental providers, and use Smile California's Find a Dentist tool. So all of these links will be available to you soon. Finally, there are some practical support like care coordination referral forms, picture books, Head Start links. There's dental hygienist liaisons, activity booklets, Sesame Street and communities, and First Five parent kits. So as we move on to the next steps, we encourage you to use these resources as conversation starters, to reach out, build partnerships, and explore opportunities to collaborate. So again, all these links will be shared in a follow-up email, and most of them are already in our chat too. So now we're going to transition to
Draw your attention to the dental liaison slide because we have the Northern California dental liaison, Heather Lawler, on the webinar today. I don't know, Heather, if you're available to just wave, but she's the dental hygienist liaison for Northern California and is a great resource that we have. So thank you. Yeah.
Yes. Did you want me to speak a little bit about it? Okay. Yes. So I am the dental hygiene liaison for Northern California, and actually that includes Central California as well. I do have a counterpart in Southern California, for those of you who are interested in near Casasola. But what we do is we're through a program of the National Center on Health, Behavioral Health, and Safety, the Association of State and Territorial Dental Directors, and ADHA. However, I just found out Friday, they have lost their funding. Lots of changes happening. However, I will still be here as a resource for all of you. While they transition, they're confident that they're going to get funding from somewhere else, but there may be some reorganization and name changes. But through that time, I will be here. Please still reach out to me. As an interested oral health professional, I'm going to bridge that gap. So don't hesitate, even if you start seeing, they're taking certain things off. I'm still here. So just I wanted to kind of let you know about that change. But so what I do a lot of different things. One of my main priorities is helping you find oral health professionals for the different things that you do in Head Start. So just to kind of give you an example, some of the things I've done in the past, and actually I have to shout out to Monica Nichols. She's an LOHP in Santa Cruz. I've done some advisories with her and sat on some advisory committees. And I also find other people as well. It's not just myself. Usually I try to take on a couple events myself every quarter, but I can't do everything. Unfortunately, I have a full-time job that I just do this outside of that, but I can connect you sometimes to other people who can. I also have done a number of health fairs, any kind of oral health information. I do staff trainings, parent events. And in fact, another shout out, Jennifer Kirby from Contra Costa. I saw you're on this call today too. Last night, I presented something about the importance of oral health and some of our key oral health issues that we like to promote for their policy council. So I do parent events and such things as well. I also help programs, identify maybe if they're having trouble, identify maybe what some of the oral health issues or concerns that they have, and help them plan events that will address those. So like I said, I do a variety of different things, and this is both for LOHPs, Head Start programs. Please reach out to me if you're looking to do some kind of Head Start event. Also, if there's and I don't know if there's anyone from the Sacramento area, I'm going to be getting out a letter soon because my full-time job is with the University of the Pacific, and we just started our pediatric clinic at our facility in Oak Park in Sacramento. So those of you, if you're having trouble finding a dental home, U of P can do that. So I'll be sending out a notice soon to all of you in that area. But please, you can reach out to us too. But we're over there in Oak Park, and we can meet your dental needs. So thank you.
Thanks for joining today. All right, next, we can go to the next steps now. Khadijah, who knows?
Yeah, we reviewed some next steps. Do you want anything else to expand on those,
Nope,
Kristen?
that's fine because I want to make sure we can get to the questions. So
Okay.
just these
All right.
announcements, I think these are clickable. So we have Head Start and COHTAC social media links if you want to follow each other, see what everybody's posting and just learn more through their social media presence. And this is for LOHPs, but we have some upcoming activities that I just want to make sure is on your calendar. And I'm not going to go over them due to time, but they are in the slide deck, and they will also be on the COHTAC event page soon, most of them. Thank you, guys. We'll go ahead and put the evaluation poll in the chat. So if you have a minute, if you can take that, and then we'll try and answer some questions in the final minutes that we have. Thank you all.
All right, so I was monitoring the chat, and there were a few questions that weren't addressed yet. The question is, how can we ensure schools are talking about and distributing COA forms? Majority of times in our presentations, parents share they never heard or seen the form. School staff doesn't know what to do with it, and who's supposed to enter score is always a question.
This is something I think gets handled differently. Vaish, I don't know if you want to answer, or if any local oral health programs want to share, either unmute yourselves or put it in the chat, some of the different ways that this is done.
So Dr. Hoft, is it fine if we email them with the response?
Yeah, so all of the questions, even the ones that have been answered in the chat, we combine into an FAQ and we'll post it on the event webpage. So some of the questions you guys asked really good questions, and I don't know the answer, and so we'll be sure to research those and get a complete reply, or as much as we can get and explain.
Kristen,
Yeah.
just in response about what to do with the COAs, since we provide the forms when I'm doing a dental screening in, say, the kindergarten class, we've sent home the forms. I'll complete them, and then instead of giving them to the secretary, Rosario has contacted the district office and found out who's responsible for doing the reporting through SCORE, and then we get the forms and turn them into that person. And so the secretaries at the schools have no clue what to do with them, and the school nurses don't necessarily know either. And that is the whole COA we've been faced with for years now. And either the parents can't read the forms and fill them out the correct way, or they don't bother, and we have to figure out whether we should be doing them or not. I wrote in the chat that we will not do a passive response to doing the COAs, because whoever's doing the screening is chancing a malpractice, because some of the parents have called and complained about, well, you touched my child's mouth and I didn't give you permission. And so passive, I won't do passive at all. So that's just information for the rest of the group. Okay.
All right, so thank you to all the LOHPs who are weighing in, and thank you, Carol, for giving what you guys do in your area. It looks like the forms are entered by a wide variety of people. So sometimes the county office of education, or the LOHP, or the school district nurses. So it's something that how the data gets into SCORE is not dictated. So each county or school district or school is doing it in a way that works for them. So I recommend that you talk to the local agencies around you. And in terms of passive consent, one of the bills that was on the timeline for the COA slides is a policy that makes COA able to be done with passive consent. So it's something where you alert families that COA, if you're doing like a screening at school, that it's happening and that they can opt out of it. So if a family does not want to participate, they can opt out. And I think there was another question about how does the forms go home? This is another great one. If people want to put it in the chat, if they know how their schools go, we can, provide kind of a menu of the different ways it's done. I know people put it in like their welcome to school packets. Some schools are more digital and they email it home. There's a lot of different ways that schools send the forms to families. Some have like digital platforms. So if you guys know different ways that it's done in the schools in your area, please feel free to share that as well. Any other questions, Janelle?
Yes, will a dental screening performed by a licensed hygienist count as a Head Start dental exam requirement?
We'll let Chris answer that one.
Yeah, we have had a lot of conversation and advice by dental providers, dentists that are on an advisory capacity, and also the California Dental Board says no, it needs to be a dentist, a DDS, that provides that dental examination. So RDHAPs, RDHs, that is whatever you want to call it, an assessment or a screening, but it's certainly, like Chriselda was saying, at Santa Clara County, it offers that that glimpse into what might be needed for that child.
And can I address the question about forms for Head Starts? I think one of the reasons that Chris and I wanted to come into this space, and thank you, Chris, for bringing us in, is on the Head Start side, you know, we don't really have necessarily forms. That's something that's done at an agency by agency level. So it is a requirement of a Head Start to meet the Head Start performance standards. So the hope would be that Head Starts and LOHPs would get together and try to create a form while also working with your Head Start program specialist and your TA specialist, and of course your executive leadership, to maybe create a form that could help both programs, right? So to meet the COHTAC and maybe the Head Start performance standards, but that would need to be done at a local level. So that's where the bringing together and collaborating and coming together on the individual level, because each school district and each Head Start is different. Those are conversations that we're hoping you guys have at the local level. I would love to create a form that's statewide, but it just doesn't work, especially with Head Start.
Great, thank you. Were there any other questions? Oh, we're actually at time. It's 12:30 exactly. Thank you, everybody, so much. We had a great discussion. Our poll just went up. If you could please take a few seconds to answer the questions for us. But thanks again, and we'll see you next month.